Ready.
Tell me when you're ready.
Roll it.
We're good.
Good afternoon, everybody. I'm Dr. Tim Peterson. I'm Medical Director for the Blood Center and for the Tulane Hospital System's Blood Bank. We appreciate all of our media being here today to help us in a very serious situation that's been ongoing for 3 or 4 weeks lately and is anticipated to possibly continue. We have a severe shortage of blood and blood components that are available for the patients in our region. Today we have doctors from our local hospitals and the city of New Orleans here who are going to share some instances and their situations that are occurring right now and that they're seeing clinically in the state, in the region. And so, again, we want to thank you all for coming. Since I'm here first, I want to give you an idea of what I'm seeing over at Tulane University. The situation has gotten extremely critical at Tulane and the other hospitals that I cover, so much so that we've had to do some postponing of organ transplantations. We've also had to postpone scheduled red blood cell exchanges for many of our sickle patients who get a monthly exchange for sickle cell anemia to prevent problems occurring. So I'm sure the other doctors will give you a similar idea, and then at the end I'll overview as to what we believe some of the reasons are and why we really need the help of you to get the word out to our public that we need their support. So I have Dr. Jennifer DeVagno here from the City of New Orleans Health Department. She's going to give you an idea.
Thanks, Dr. Peterson. Thanks, everybody. Most of the time when I get up here, I talk about COVID, and certainly COVID was one of, if not the leading cause of death in New Orleans over the past year. And it's taken a lot of attention. Blood donations were critical for many of the patients that we saw in COVID for a variety of reasons, because they have so many different complications that can happen. But other emergencies didn't go away. And as the city and the country has reopened and as folks are returning to their normal lives, with that comes the normal emergencies that require blood on a daily basis. So it's the severe car accidents, it's the surgeries, it's various bleeding conditions, various cancers, where patients present to emergency departments like the one where I work, very, very sick, critically ill, with blood being the treatment that they need in order to sustain life. So continuing to deal with the COVID pandemic and all of its challenges in the healthcare system, as well as now the possibility of a real blood shortage, would be absolutely devastating if we allowed that to continue. So, as an ER physician, as a health director, I really urge everybody to do their part to keep our community protected. Number one, get your vaccine. Number two, when you're done getting your vaccine, please consider donating blood. Thank you.
Hi, everybody. Thanks for coming out. I'm Dr. Lewicki. I'm the medical director of the blood bank at University Medical Center. So as I believe we are probably the biggest user of blood in town, since we are the major level 1 trauma center, as well as the major burn center, and along with all the other things that we do. Unfortunately for us with trauma, we certainly are also postponing surgeries, sickle cell exchanges, things like that. Our major issue is a lot of our patients can't wait. And that is a huge problem, and to be honest, we have been extremely lucky that we have not had several severe traumas in a row, that I'm actually very surprised that I have not yet, unfortunately, had to make a call of I don't have blood to support someone who critically needs it. We have done things to, adjust what we do to try and have more blood available, which luckily has gone quite well, and again, we've been very lucky. But a single trauma patient can use over 100 units of blood fairly often, and we've just been very lucky that has not happened. Other issues kind of for us, obviously, that also, puts everyone else out and makes our normal services very inconvenient. We are also postponing surgeries, those sorts of things. But a big one for us is just those trauma patients who can't wait. And I think it's a big thing to be aware of, that although we've had COVID and a lot of people have been stuck at home and things like that, a lot of our trauma patients and severe traumas have actually gone up in the last year. Amazingly, less people are on the road, but we've had more serious and fatal accidents in the last year than we had previously in 2019. And actually right now, I can tell you, we have been giving out more blood for the last 3 or 4 months than we ever had before. Our last 3 or 4 months have been the busiest months we've ever had at university. So it is very critical for us that, we very much have patients who cannot wait. And I kind of encourage everyone to go donate, and always keep in mind that it could be you or your family member who's in a bad car accident or some other traumatic episode, and that you can't wait when that blood is needed. And of course, for us as a trauma center, we especially encourage anyone who is a type O. You are the universal blood donor. We need your blood above everybody else's. So please get out there and roll your sleeves up. We will all greatly appreciate it.
Hello, I'm Dr. Corey Bear with LSU Health Sciences Center, and I just want to make an appeal to the community, because what we're looking at is a very dire situation. People like to think about giving blood as something that someone else does, or when they feel okay about it. I'll go do it next week, I'll do it later. But what we have to remember now is that so many people didn't get anything done during COVID because they thought it was going to be unsafe. They didn't get their screening mammograms, their prostate exams, their any type of preventive measures. They didn't do any of that because they thought that if they went to those places, they'd get COVID-19. Let's be honest. So we have to first say that it will be a safe place and a healthy place for you to get your blood drawn, and for you to be able to even find out what your blood type is. You need to know what your blood type is, but you also have to remember that this could happen to you or someone in your family. So you can't ask someone else to do what you need to do as a responsible member of our community. This is a New Orleans community. We're very tight-knit, and we've seen people out doing all types of things. Crawfish boils, parties, graduations. We need to have you now do the things that we need you to do to make our community thrive. And I do want to make one extra push here for the sickle cell community. Sickle cell affects 100,000 people in America. 4 million people have sickle cell trait. So what you need to find out as well is if you have sickle cell trait. So many people in New Orleans have no idea. You need to find that out, and by coming to get give the blood, you can find out a lot of things about yourself. But what you also have to remember is that these folks that have sickle cell disease, they need blood transfusions, a lot of blood transfusions. And if we can't do that for the folks that are hurting most in our community, then what kind of community are we? So I'm making a final push. Please, if you know that you're a healthy person, can come out, give some blood, please roll up your sleeves. It will be greatly appreciated, and it will always come back to you. Karma is something that we cannot get away from. Thank you.
Hi, I'm Dr. Matthew Stark. I'm here from Children's Hospital. I'm the medical director of the Transfusion Services, and I'll have to remember to never go after that man again. He's excellent. So the question is, where does this blood go? You're going to roll up your sleeve, you're going to give your time, you're going to give your effort. You're going to come somewhere that you're scared to go to, and who's it that's going to benefit from this? And for us, at Children's, it's neonates. It's people smaller than a football that need this blood. It's people that have congenital heart disease that need this blood. It's people that have brain tumors. Right now, we have a child going over to West Jefferson to get embolized. Once that child's done being embolized, he's going to be sitting on a surgery room table. They're going to put instruments inside this child's head and try to remove a brain tumor. And that child's going to need a ton of blood. I was thanking Ian, I was thanking Mr. Wilder this morning. Tell him that I walked in and my blood fridge was full this morning. It was like Christmas morning. There were some days when I walk in, I had 2 or 3 units left for these children. And it's be a very dire situation. So I want to thank you in New Orleans who have been giving blood, and I want to thank you that are coming out this week to give blood. On Wednesday, I want to invite you to Children's Hospital State Street campus to give blood. And if it's not you, then who's going to come? Thank you for your time.
Oh, pretty good.
Thank you. I learned something today.
No.
Well, now I'm going to put on my hat as medical director for the Blood Center and thank the physicians for being here to support the Blood Center and our community with their appeals for blood and blood donations. There's a lot of reasons why we believe blood donations have been down, and it's not just here, it's a nationwide crisis. Recently our governor came out with a proclamation asking all who are eligible to donate to please consider becoming a donor. And we've really had kind of the perfect storm that hit. In the last 3 weeks, we've had enormous amounts of rain, 3, 4, 5 days in a row with multiple inches every day that are affecting people able to even get out and go to blood drives. With the hospitals, as Dr. Vegnu mentioned, coming back on and the community opening up, many, many more elective procedures are being scheduled. And unfortunately, the third part of this is a lot of our donations come from high schools and colleges. About 25 to 30% come from our young donors. Don't ever let anyone say that our youngsters do not do their part. They are very, very strong when it being support of the blood center and donations. But unfortunately, with remote schooling, many of us are unable to go out and have mobile drives at their centers. Plus, of course, many businesses are shut down and people are doing mobile, or rather doing remote work, and we just don't have the locations to go out to do mobile blood drives. So when all of this comes together and the anticipation, we know that summertime is a very difficult time to donate blood because schools are not in session anyway. So we're coming into a very critical time of the year. More people will be traveling on the road. There will be more instances of trauma situations occurring, accidents, as Dr. Stark has mentioned and as Dr. Lewicki has mentioned. So we really, again, we ask people, if you've never been asked to be a donor, come in, be a donor. And if you are a donor, be a regular donor. We're really not just asking you for your time, we're asking you for your blood, we're asking you for something much more important, your time. That's the most precious thing you have to give. But an hour of your time donating blood can mean a lifetime of the patient who receives it. So again, thank all of y'all for helping us. Thank the city of New Orleans, our region, South Louisiana, and into Mississippi Gulf Coast. You've been strong supporters, and we really need your help now and as we move forward into the future and continue to open up. Thank y'all.
Can y'all tell the public, does it matter if they've been vaccinated or not, and does it matter if they've had the wild virus, COVID virus, or not? To be a donor?
Excellent question. Ask whether we would, is vaccination or having had a history of COVID. Currently, you can get the vaccination and donate immediately. There is no deferral for it. We encourage anyone who's been vaccinated, please come in and donate. If someone's had a history of COVID, it's asked that you wait, get over COVID, and feel completely normal for a minimum of 14 days. After that occurs, you can come in and be a donor. And not only that, there was a strong push to be a convalescent plasma donor. And those donors who had a history of COVID and have come back and donated plasma help save many, many lives with their generosity.
And if they haven't been vaccinated, you still want their blood?
We'll take all donors who are eligible, and there's very few conditions. As long as you're 17 years of age or older and in good health, you essentially can be a donor. And there are very few medications that would preclude somebody from being a volunteer donor.
And one more quick thing for the Level 1 Trauma Center. You said the last 3 months, 4 months has been the highest ever. Is that because of the crime, the GSWs out there that's going on, and as well as the car wrecks?
That has certainly contributed to it. I will say we've had probably a higher number of really severe patients as well as just a higher number. But I will say it's also not just the traumas, it's also the fact that we are also doing a lot of elective surgeries, that sort of a thing. So our increased numbers aren't just trauma, but certainly we've seen a lot more trauma than we were used to.
From crime.
And if I can, I just want to make a corollary to that. That's not just New Orleans. The Level 1 Trauma Center at UMC has 10 parishes that feed their trauma directly from the scene to them, and then and get transfers from everywhere you can imagine, places in Mississippi for trauma. So it's not just the challenges that we, like many cities, are having with violent crime. This is regional and this is statewide, but they all end up at UMC
Right.
because it's the only trauma center in this.
We only have 2 level 1s in the whole state.
Yeah.
So, and we actually do serve an area of southern Mississippi and a lot
Right.
more than just Louisiana.
But crime, car wrecks, and more elective surgeries.
Yes.
Okay.
We have one more, the concept of the person that has received a monoclonal antibody.
Yeah, currently, they ask about therapy for monoclonal antibody treatment with COVID. The FDA gave no guidance on that. And so what the medical directors for blood centers across the country, when we got together and spoke about it, even though it is manufactured, it is not derived from human cells or tissue, since the FDA didn't give us any guidance on it, we decided that if you receive monoclonal therapy for COVID antibodies, we would wait 3 months. And that was similar to someone who's received a transfusion or received convalescent plasma. And we just did that because it was convenient to have a consistent message when it came for therapy. So we've gone to 3 months. Any other questions? Again, thank you all so much. Thanks to the doctors for taking the time on a busy day to be here.
Thank you.
And thank you guys for always supporting us. We'll get through it.
Make it happen. Tell your friends, make sure that you need it.
Thanks. Jennifer, thank you so much.
Well, nice to meet you. See you on the news.
Oh, yes, sir, nice to meet you as well. I'll see you. Many charts and many orders and